Hello, my name is Dr. Srikanth V. Breast implants are designed to last for a lifetime. However, there are certain times in your life where you may need to go in for a breast implant revision surgery. The first one would be if the breast implant gets deflated. That means it collapses. If it is due to some reason the capsule ruptures and this does not have a memory gel, then the silicone gel may leak out. If it is a saline-filled implant, the saline will leak out and one breast will look bigger and the other one will look smaller. Now, when this happens, you are a candidate who should undergo repeat surgery. Ultrasound or an MRI will help to diagnose this. The other category of patients are people who have complications because of the breast implant. Now, whenever there is a breast implant, there is a capsule which forms around it. Now, this capsule is generally predictable, but certain individuals tend to form a harder capsule over a period of years around this implant. Now, this scar tends to contract. The condition is known as capsular contracture, and these tend to be a little painful. Now, when this happens, you will notice that the breast feels tender, it feels hard, and you may find that the previously which used to be symmetrical may not be symmetrical because one side is contracted more and less. And when you notice things like that, then it is a time for you to visit a plastic surgeon, find out if you are a candidate for a revision breast surgery. People who undergone breast implantation, they are a little worried of a second surgery. They do not want a surgery. So they would like to know, can a breast implant be replaced without a second surgery? Unfortunately, the answer is no. It is a full-fledged surgery under general anesthesia. And if there is any element of asymmetry or difference between one side and the other, it is probably more challenging for your surgeon to replace the implant than to a simple fresh case of a breast augmentation. So the answer is no. Without a full-fledged surgery, you will not be able to replace a already implanted breast. Now, when the breast implant is there in the body for a long time, they can undergo certain complications like an implant rupture or a capsular contracture. So first, I will talk about an implant rupture. In the current generation of implants, we don't expect any implant rupture unless there is a blunt or a heavy force trauma. That is, you're involved in an accident with a two-wheeler where you're sitting behind, you go hit the car seat in front and you happen to get hit on the chest, and the force of the accident is borne by the implant and it ruptures. So it is an incident which you will remember, and following that you will find that the breast is deflated on that side. That is an implant rupture. If you have undergone an implant long ago or you opted for a saline implant, it is possible that the capsule of the implant may degrade over time and leak the saline out and the implant will collapse. Now, if this happens, you will notice that over a period of time that you will see that one side is bigger than the other, and this time then you know that the implant has ruptured. If you are one of those people who had a silicone gel but not a memory gel implant placed, you will find that there is a difference between one side and the other because the silicone capsule has ruptured, the silicone gel has leaked out and leached out of the implant and has gone to the surrounding areas, and therefore it does not give you the same volume. You may notice a little bit of contour abnormalities, especially when you touch. You may not see it, but when you touch it, you will find that one side feels different from the other. And that is the time probably you can diagnose that you have a ruptured implant. A ruptured implant can be diagnosed using an ultrasound, or better still doing an MRI scan, which will tell us what has happened to the implant. Coming to breast implants, do they need to be adjusted or replaced as a routine? No. Once you put a breast implant, it is expected that the implant is going to last for your entire lifetime and we don't need to replace it. However, if you have a complication like a capsular contracture or an implant rupture, then you need to replace it or you need to adjust it. In certain cases, sometimes if the breast implant slips out of the pocket where it is meant to be, then you can have what is known as a double bubble deformity, where you have one lump here, suggesting that your implant has come out of the intended position. Now, if any of these happen, only then probably you need to go for an adjustment surgery or a revision surgery for a breast implant. But otherwise, breast implant surgery does not require any revision any time in your life. Now, are there risks with multiple breast surgeries? Most definitely, yes. Any time that you undergo multiple surgeries, it means that things are not okay. And also when we know that you had a breast implant The breast implant is a foreign body. It induces reaction. It forms a capsule. So multiple surgeries have their own drawbacks. So the scar that is there will not mold like a normal breast tissue. It may not give you the desired shape. It may be difficult to place it in the exact position that you want, therefore not giving you a desired result. So when you're undergoing multiple surgeries, it is my suggestion that you meet somebody who has done this before, who understands and is able to identify all these problems, whether it is there and how to solve it, because very many techniques are there in which you can redo this breast surgery. However, you should know that somebody who is experienced is the one you should be going to. And with multiple surgeries, the breast tends to get scarred, and once you have a scarred breast, it is very difficult to give a pleasing shape. Therefore, take the decision about a revision breast surgery very carefully.